U.S. has some of the best health care available anywhere in the world. The truth is, as a nation, we're getting sicker and sicker. Now, most of us know this, and we also know that if we want to avoid illness and enjoy good health throughout our lives, we have to take good care of ourselves. And when we do get sick, it only makes sense to consider all the factors that affect our health, especially nutrition. Hi, I'm Janice Marie, and we're here today in East Meadow, New York, visiting the office of Dr. Christopher Calapai. Dr. Calapai is an osteopathic physician, and he's one of a growing number of doctors whose approach to healthcare is unique in that it focuses more on the health than on the care. It's what he calls a comprehensive medical nutritional approach, and he's been delivering some pretty exciting results and changing lives all over the country for over 20 years.
This is an office where you can come in with any wide range of different medical problems or symptoms and learn a great deal about your body. In learning everything that we can about your vitamins, minerals, hormones, digestive ability, allergy, immune response, cardiovascular risk, we can, with that information, maximize your health and give you a long-term plan to stay as healthy as humanly possible and to go well beyond what traditional medicine does.
Now, you're an osteopathic physician. Exactly what does that mean?
Osteopathic medicine differs from allopathic or traditional medicine in a variety of ways. Osteopathic approach is more geared at understanding the patient. It's a holistic approach, and we have more things that we can do that may involve dietary or exercise-related techniques. As most individuals have already experienced, they go to the doctor, he'll spend 3 minutes with them. That's the average visit in a doctor's office today. So they're not really getting a good education of what's happening in their body. The doctor hears what they're saying and may do some basic or cursory testing and put them on prescriptions. So that is what fuels traditional medicine. The insurance companies love that because the doctor is not costing them a lot of money in testing. The drug companies love that because the doctor is putting people on one pill, another pill, but people are frustrated because they're not getting an education and they don't have any mechanism to help themselves become healthy. So we're trying to put it back on the patient. We want you to eat right. We want you to exercise. I want you to get involved. And that's the big difference between what I would call a comprehensive medical nutritional approach and traditional allopathic medicine.
You know, Dr. Calapai has this way about him where he makes you feel like nothing can't be managed. I want to enjoy my later years. I want to be ambulatory. I want to be mobile. I want to be able to travel. So I'm trying to do the right things now so I can enjoy a nice life in my later senior years. But I just get the feeling that they really do care. And it's different because doctors are so busy. They're running through patients, and it's one of the problems with the healthcare system we have. But I feel very, very comfortable with Dr. Calapai, his staff, and I can't say enough good things about them.
Who are the people who come to see you? Are they people who've given up on traditional medicine or people who maybe never believed in it to begin with, or both?
I have a very wide range of patients in my practice, and many of them are nutrition oriented and they love taking vitamins, and they shy away of traditional medicine because they didn't get any answers or they didn't get the appropriate evaluation or care, or the doctor didn't want to explain anything. We have patients who have never been to nutritionally oriented physicians before and have heard about it because their friend did so well they want to know what this is all about. We have patients that have gone through traditional medicine and seen 20 doctors and still haven't been told what the cause of their problem is, because traditional medicine is not looking for the cause. They're looking to change the symptom. So 99% of the patients that I see are looking for answers, looking for more information. And it's not difficult to give them that information when you do a real thorough approach.
I had a terrible pain in my right shoulder, and I went to 2 or 3 orthopedists, and at that time they told me that I had a torn rotator cuff and ripped cartilage. The orthopedists all wanted to do surgery on me, which I refused. So I came here and I did prolotherapy, and after the first shot, I couldn't believe it. I said, this is really crazy. Maybe I'm losing my marbles because I haven't had sensation in my right shoulder for so much time. So I said, all right, that's cool. After the first shot, I came back again the following week, and I had another one, and 4 in a row. And after the 5th one, I was back to doing I'm a dance teacher. I was back to doing my dancing. I was back to washing my hair, and it's just a miracle.
I know you give a lot of programs around the community and on the radio. When people hear you speak for the first time, what do you think intrigues them about the way you approach medicine and health?
There are many people who don't understand what we're talking about initially and are resistant because they're used to going to their primary care doctor and seeing him for a few minutes, getting a prescription. If people don't get a prescription, they think they've been gypped because they expect to get something that only that doctor can give. So when I sit down and talk with them and tell them they have to make some changes in their diet and we want to test and correct their nutrients and make them work a little bit, sometimes they're apprehensive. But the people that are initially the biggest skeptics become the biggest fans because they are so non-believing in this that when they start to change their diet and they feel better, they have more energy, they've lost some weight, their cholesterol is coming down, their blood sugar is coming down, they feel like a different person, and now this becomes something that they own. They're doing it. They feel proud of themselves. They're becoming proactive. So it takes a person who was not really active in the process, putting them psychologically into it. They have control, and everything they're doing is coming out for the better. So it gives them a great sense of satisfaction. It's reinforcing. So they continue to do it, and all of a sudden they're raving about it. And they'll send 10 other patients who are non-compliant, and now those people will become, followers. It's relatively easy because it always works. It always works because we're looking at 100 different parameters. We're not just looking at 2 or 3 basic blood tests and telling people to take meds.
I had a lot of different problems. My husband, because he knew I wouldn't go for conventional medicine, he knew I would not go to a doctor who was going to start to shove drugs down my throat, happened to hear on the radio one day Dr. Calapai. And he comes home and he says, "You're not going to believe it, honey, but I found a doctor for you." Honestly, I really did not feel that it was probably going to do much for me. To my surprise, within about 2 to 3 weeks, I couldn't believe the difference that I was feeling. I feel great. It's wonderful to know that without having bad side effects from medications and stuff like that, that you could feel so much better inside. And I truly stress to people, if you're sitting back and you're thinking, yeah, right. I was like that. Come and see the doctor. Come and let him check your blood. Find out what things are wrong with you, what you're needing, and give it a chance. It's not going to happen overnight, but you give it a chance and it's going to work for you.
Talk about some of the results that you see with your patients, and how does that make you feel?
It's so wonderful to see patients gaining control of their lives, getting more mobility, and getting their function back. Sometimes it's overwhelming, but it obviously is my goal. It's what we're here for. I want people to be able to be as healthy and be the best they possibly can. And that further stimulates me to look for more information, more research, and be able to do more with patients. There are studies now that say using some vitamin therapy intravenously, like vitamin C, helps to selectively kill cancer cells. There are people doing intravenous vitamin therapies like alpha-lipoic acid, along with naltrexone, which is a prescription, that are living months and months and years when they're told that they wouldn't live, that have pancreatic cancer and spread of pancreatic cancer. So the nutritional realm is the place to be. Everybody needs to learn about nutrition. Everybody needs to test and correct their issues. There's so much that you can do.
So as you can see, good health is within your reach with the help of Dr. Calapai. Reporting from East Meadow, New York, I'm Janice Marie.